Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen, my dear fellow students and those friends and those colleagues who are appearing in any membership examination or fellowship examination in Pakistan and other membership examinations in European territory or steps examination in the American territory. I am Professor Sayyid Ali Haidar. I am on the path of taking the serial of lectures on a very dry subject. For you, it is dry, for me it is wet. And that is infection and disease, infectiology. And I already mentioned that if you don't know the details of the different microorganisms, then you are not able to answer it, or you are not able to pick the MCQs in the examinations. One has to be 100% sure when he is appearing in the examination that he has been properly studied the subject. That is why I am taking every bacteria, every other organism, microorganism which is important for the humans and causing the disease. I am the honorary global professor of medicine without any fame, name or economics. So, Chalymydias, genus Chalymydias. These are these small bacteria, the cocoa-based type of the organisms, and they are very weak gram-stain, it means gram-negative organisms. They are intracellular obligates, means that they are parasitizing the cells and they survive there in the environment. An important thing about it is this, that they replicate inside the cell, which is the media for them, and then there are two types of the mechanisms they obtain. One is the formation of the elementary bodies which are infective, and the remaining remnant are the reticulate bodies which are not infective, but they can convert later on the same, that the elementary bodies, and can infect the person. So these are the very important characteristics of these type of microorganisms. For a long time ago, since about 30 years, the people are working on it, and they have found that their associations are proved in certain animal and the human models, that they can initiate the process of atherosclerosis or in autoimmune diseases or in cases of multiple sclerosis, etc. So microbiological cause is detected in pathology, and that is very, very important evolution in the field of medicine, because you can manage it properly. And that is the tool of the management. That will become tool in the future. Now, Chalymydias, I have already said that the small gram-negative bacteria which are not uncommon. Not uncommon means because they are not considered when you are making the differential diagnosis, although there is a possibility that the person has been infected with the Chalymydia. There are three main species of Chalymydia causing the human infection, although there are a lot of others are there. One is Chalymydia, C.TRACHOMATIS, Chalymydia pneumoniae, also known as the Chalymydia pneumoniae, and Chalymydia psittaci or psittacosis. Now all diseases are called Chalymydiosis. So let's take one by one. This is the part one of my lecture, that is Chalymydia C.TRACHOMATIS, which is a commonest organism in this group. That's 60 to 70% of all chalymydiosis is caused by the Chalymydias trachomatis. At one time, trachoma was the main cause of blindness in the world, number one cause. When I was a student in 1974-75, it was told by my ophthalmologist professor that this is the commonest cause. Nowadays, the commonest cause of the blindness in the world is the diabetic retinopathy, not the trachomata or trachomatosis or trachomas. The Chalymydias trachomatis was famous for its specificity for the eye infection. Why it is important? Because the disease is not so commonly seen as the eye involvement is concerned. But why it is so important? Chalymydias trachomatis. What is the importance nowadays? What is the importance of Chalymydias trachomatis nowadays? If somebody is sitting in front of me in the examination, I will ask this question. Why it is important? Chalymydias trachomatis. What will you answer? If you are listening this presentation or watching this presentation, then try to answer it after this session. The introduction is this trachomatis, commonly known as the Chalymydia, is a bacterium that causes the Chalymydia, which can manifest in various ways. It can cause trachoma, lymphangranuloma venereum, non-gonococcal urethritis, serositis, salpingitis, pelvic inflammatory disease that is called PID, and is the most common infectious disease of blindness, one of the most common infectious diseases of blindness, and most commonly sexually transmitted bacterium. The different types of the Chalymydias trachomatis cause different diseases. There are serotypes. The most common strain causes disease in the genital tract. Among them is the genital tract, while other strains cause disease in the eye or the lymph nodes. There is trachoma of the eye and lymphadenopathy. There is lymphangranuloma venereum. Like other Chalymydia species, the Chalymydia trachomatis life cycle consists of two morphologically distinct life stages. Already said that the unique thing is their formation of the elementary bodies and the reticulate bodies. Now, elementary bodies are spore-like and infectious, whereas the reticulate bodies are in the replicative stages and they are seen only within the host cells. They are not infected. Afterwards, they become infected. For example, all elementary bodies are eradicated, but replicative stage, that is reticulate bodies, are remaining. So the infection will reoccur after many days. The global prevalence is this: women are more affected than the men, and women between the ages of peak is 15 to 19, with a high, sexual drive is there, followed by the women aged 20 to 24, all youngs. The rate of increase of diagnosis is greater for men than for the women. And they are seen in the most countries where the unprotected sex was practiced, and the multiple partners, just like HIV, lack of condom use, and the low socioeconomic status living in the urban areas. In African countries, in the South American countries, this disease, as infecting the genitourinary tract is concerned, is very common. The pulmonary infection can occur in infants born to the women with active Chalymydia infection, although the rate of infection is less than 10%. And the other ocular infections, like the form of inclusion conjunctivitis, trachoma, both adults and their children are seen. About 84 million worldwide develop the Chalymydia trachomatis eye infection, and 8 million are blinded as a result of the infection. High rate. But nowadays, the diabetic retinopathy and the hypertensive retinopathy are among the commonest causes in our zone. Trachoma is the primary source of infectious blindness in some parts of rural Africa and Asia. is a neglected tropical disease that has been targeted by the WHO. At that time, I was admitted, I was in first year MBBS. They are all fear of trachoma, and I have also served in the army for 2.5 years, where my commanding officer said that please examine for exclusion of the trachoma, because I was in the field. So they were so much worried about this disease. Inclusion conjunctivitis, that is trachoma, from this Chalymydias is responsible for about 19% cases in adults for the conjunctivitis is concerned. The prevalence in Pakistan, although it is difficult to study here in Pakistan because of the lack of its facilities, availabilities, consent, these are the problems. Even the journals who are, if you research it by your own source, even the journals in Pakistan, they will take money for the publication, because they said that these publications are not sold out and they are in loss. That is why they are taking the money for the publication. It is very unique, Baral anyway. Our estimates of Chalymydia prevalence were broadly comparable with those reported in other populations. Base studies showing prevalence rates ranging from, in Pakistan, is 4.1 to 5.2, around 5%, by immunoassay or by gram staining or by culture. PCR is also a diagnostic test, but it is rarely done. Morphologically, you see the intracellular obligates. They are parasitizing the cell, where the life cycle is this. You can see the formation of the elementary bodies. They are infective. They infect the other cells surrounding, and they are also in division as the reticulate bodies. They can infect the eyes. They can infect the other systems, the genital tract, and in some cases they are also important for the urinary tract. So this is how they are moving. A lot of elementary bodies burst out. In fact, the other cells, and some are remaining as the reticulate bodies for the future infection. And this cycle is going on and on. In hours it will complete. The other surrounding tissues are infected. They can enter into the blood as an elementary body, because it is engulfed by the neutrophil, and inside the neutrophil they become more satisfied. And where they are more satisfied, again the elementary bodies will produce reticulate bodies, and the cycle going on and on and on. Here this is infection. You can see they are remaining here. This is the cell wall there. These are the elementary bodies. Life cycle, I have just told you about it. The elementary bodies, they are surrounded by a rigid cell wall that allows them to survive outside the host cell. Reticulate bodies, they are found only with the host cells. Neither form is motile. They are non-motile. The Chalymydia trachomatis genome is substantially smaller than many other bacteria, at approximately 1.04 megabases. The genome is concerned. Now, in addition to the chromosome which is involved with this disease that contains most of the genome of this disease, nearly all Chalymydia trachomatis strains carry a 7.5 kilobase plasmid that contains 8 genes. The role of this plasmid is unknown, although the strains without the plasmid have been isolated, suggesting it is not required for the survival of the bacterium, although the plasmids are formed. Now this is again the cycle is elaborated in this manner. The cells are intercellular obligates. This is the nucleus of the cell. Inside again there is you can see their formation, and they enter into the nucleus, and the formations of the reticulate bodies are seen here. The elementary bodies and reticulate bodies. the bodies, that is the elementary bodies. They attack with other cells. Again, this process will take the burst out. Then, in fact, the other cell reticulate bodies are also there for, hand to hand, and in this fashion, the binary fission of the reticulate bodies, because it is a binary fission which causes replication of the bacteria. Although this is not infective. Now, in fact, the recognition of the reticulate bodies into the elementary bodies. Afterward, the reticulate body will convert into the elementary body, again infecting the cell, again burst out, again the cycle is going on. In hours, this cycle will be completed. Classification lesions are concerned, the ISAT is the obligate intercellular parasites of the eukaryotic cells which are formed by the enterocytes. Chalymydias cells cannot carry out metabolism and they lack biosynthetic pathways, that is why they are called parasites. They are bacteria, but they are intracellular obligate parasites. So it is the MCQ then, very, very important MCQ. Which of the bacteria will act like a parasite as obligated intracellular? A, B, C, D, E. Now, Chalymydia strains are generally divided into three biowars. One of the type of the disease they cause. And of course, there are many surface antigens which are liberating from it. And serovirus A and serovirus C cause trachoma, which is the world's leading cause of the preventable infectious blindness. Serovirus D through K infect the genital tract, so D and K will infect the genital tract and causing the pelvic inflammatory disease, ectopic pregnancy, and infertility. Serovirus L1 they are the positive agent for the lymph granuloma venereum, which is STD, sexually transmitted disease. Chalymydia trachomatis is thought to have diverged from the Chalymydia species around 6 million years. Very, very long, period of survival. This genus contains a total of 9 species, which are named here. I don't want to, but it is said that they are involving the horses and marssuels and frogs. Some of the other species can have a considerable impact on the human health due to their known zoonotic transmission. So it may be a zoonotic disease. Again, the MCQ. Which of the following is a zoonotic disease? A, B, C, D, and E. Pick it up. Pathogenesis. The pathogen is the same, and I said that infected. They are generally present in the semen of the infected man and the vaginal secretion of infected women. When they come in contact with the new host cells, the elementary bodies bind to the cell via interaction between the adhesins on the surface and several host receptor proteins and heparan sulfate proteoglycans. When attached, the bacteria inject various effector proteins into the host cell using a type 3 secretion systems. These effectors trigger the host cell to take up the elementary bodies and prevent the cell from triggering apoptosis. They prevent apoptosis. Within 6 to 8 hours after infection, the elementary bodies transition to reticulate bodies will occur, about 8 hours, and a number of new effectors are synthesized. In this session, the cycle is going on, and specific sites are involved accordingly. The presentation in this case, one of this is the infection in the genital tract, Chalymydia infection, which may be asymptomatic. It may resemble as the gonorrhea, so it is one of the commonest cause of the known gonorrheal STD. Both are common causes of multiple other conditions, including the PID, pelvic inflammatory disease, and urethritis. If there is urethritis, it means that they will cause the urinary tract infection. So afterwards, I would say the other bacteria are definitely important. But Chalymydia trachomatis is one of the commonest cause after the Escherichia coli in your country. Chalymydias, or the other one, mycoplasma, for example, unusual causes resistant to the common antibiotics. The Chalymydias is the single most important infectious agent associated with blindness. One of them. And it also affects the eyes in the form of inclusion conjunctivitis and is responsible for about 19% of all cases of conjunctivitis. Chalymydias in the lungs is present in the children, present as the Chalymydia pneumoniae respiratory infection and can affect all ages, usually the children who are born in an infected mother. Most people with the Chalymydia are asymptomatic. When they are invading the different systems, the characteristic feature will occur. For example, dysuria, vaginal bleeding, genital discharge, perianal or perivaginal itchiness, and dysuria, and it is the symptoms as same as urinary tract. That is, the question is very important. The organism after Escherichia coli, in your country, the commonest organism is A, B, C, D, and E. When Chalymydia is present in the eye in the form of the trachoma, actually it is a malignant process. Inclusion bodies will occur in the conjunctiva and the bulbar conjunctiva and pushes the eyelids to upwards, and there may be formation of the inclusion conjunctivitis, presence as a redness, swelling, mucopurulent discharge of the eye, and the most other symptoms associated with the adult conjunctivitis. Important thing is that they will invade the cornea and destroy the cornea. So blindness occurs. Although you can implant new cornea, transplantation of the cornea, the patient will be okay afterwards. Treatable condition, when Chalymydia is in the lungs in the form of the respiratory infection, it typically has symptoms of running or stuffy nose, first of all, low-grade fever, hoarseness of the voice, and other symptoms associated with the general pneumonia. Any pneumonia can cause like this. The clinical findings will be the same as in pneumonia. So Chalymydia may latently infect the chorioniculi, tissues of pregnant women, thereby impacting pregnancy outcome. It can abort it. So miscarriages are there. This is the genitourinary infections. It's elaborated and intensify to you that this is the commonest cause, next to the Escherichia coli. As far as UTI are concerned, and the pelvic inflammatory, the number one cause is the gonorrhea at one time. Now it is the Chalymydia trachoma, which is the commonest cause. Now symptoms in man is penile discharge, burning, painful during urination. There may be a testicular swelling associated with it. It means epididymal orchitis can occur because the infection is traveling by the elementary bodies, side to side, cells are infected. In the women, the vaginal discharge occurs, burning, painful during urination, abnormal bleeding between periods. Ectopic pregnancy's chances are more. Lymphodenoma venereum is another disease which is seen in the penis. There is ulcers formations, seen in the vagina also, here ulcers around the perineum. Now the first stage is that the small short-lived ulcers. Contact site is the porte of entry. This is the first stage. The second stage is the lymphatic dissemination. It is a painful lymphadenopathy and is associated with the constipation and discharge of the inguinal lymph nodes specifically, and other group of lymph nodes which are connecting with the inguinal lymph nodes. There will be malaise, then fever, and the muco joint pains and the muscular joint pains. So there will be a reactive arthritis associated with this disease. The third stage of the limb granular venereum is that it is the irreversible fibrosis occurs. So it is ended as fibrosis, not as a resolution. Strictures can form, fistulas can form, and the limb will be swollen up like elephantiasis, and the anorectal syndromes can occur in this condition. Some of the people have got nothing except itching around the penis and you can penis and around the root of the penis. There are a lot of itchings. Trachoma, normal conjunctivitis is the stage first. Then trachomatal inflammatory folliculitis will occur in the eye, and the conjunctiva is definitely occurs and the tarsal bones of the eyelids are affected. Then the another stage comes the trachomatous inflammatory intense type. And here is the inflammatory thickening of the tarsal conjunctiva that occurs most half of the normal. Now these are the stages in which you can manage it easily. Just flap the eyelids up and see this type of reaction which is seen here. If this is this formation, look what is formation is there. This is the present inflammation of the tarsal bones, so called, of the conjunctiva, that it invades the cornea afterwards and opacity occurs. Diagnosis by many means it is a possibility. Direct evidence is more common, more useful. Most stain of the trachomatis recognized by the monoclonal antibodies to epitopes in the BS4 region of the mom, and however the monoclonal antibodies may also cross-react with the two other Chalymydias species. Not specific, but it can be demonstrated by the monoclonal antibodies. Nucleic acid amplification tests, that is called NAT, tests find the genetic material, and they can test are the most sensitive tests available, meaning they are very accurate and very unlikely to have false negative results. PCR is an example of this test, which is available, is the nucleic acid amplification test. And the test can also be done in the urine sample and the urethral swabs in the man, or the cervical or vaginal swabs in the women. Nucleic acid hybridization test can be possible. That is called DNA probe test. A probe test is very accurate, but is not so as sensitive as the nucleic acid amplification test. Whatever ELISA, if you go to ELISA, the IgG, IgM, there are two antibodies which are formed. If it is IgM, it is recent, and if it is IgG, it means that the infection is subchronic, at least. Direct fluorescent antibody test also for Chalymydia antigens. And this is the direct evidence, the cell culture in the test. The suspected Chalymydia sample is grown in the vial of cell because they are intercellular obligates. And then you go for the microscopy, and that is the electron microscopy, to view it in that microscopy. Otherwise, you can find in the fluorescent light microscope. But it is expensive. The culture is expensive. The culture must be grown in a laboratory. Of course, it should be grown in the laboratory, and there is direct evidence of the infection. The treatment is that it is an uncommon disease. There are sensitive antibiotics should be used. Macrolides are very sensitive, azithromycin, erythromycin, and then fluoroquinolones, ofloxacin, ciprofloxacin, and third is the tetracyclines. The first drug of choice are macrolides, the second drug of choice are the quinolones, and third drug of choice are the tetracyclines. But if you will go for the dual therapy like azithromycin with doxycycline, it's called equivalent to treat the Chalymydia in 97 and 98% of cases respectively. So the monotherapy is sufficient. Azithromycin 1 gram tablet is given by the mouth as a single dose, primarily to help the concern and non-adherence. So the reticular bodies are suppressed, and the elementary bodies they will attack directly by the azithromycin. Going for the doxycycline 100 mg twice a day for 7 days is equal success to expensive delayed release doxycycline 200 mg once a day for 7 days. You can use it. I have used doxycycline many times in this condition. Ointment is also available as a tetracycline ointment. Erythromycin is less preferred as a GI side effects because of it, which can lead to if it's a very severe infection, you can dual therapy can be given. Otherwise, the monotherapy is sufficient. Another, for quinolone, levofloxacin and ofloxacin, they are no better than azithromycin or doxycycline and are more expensive drugs. So this is how we manage. The first drug of choice, the second drug of choice, and third drug of choice. The diagnosis already I already said it is done, and about further discussion, the levofloxacin, ofloxacin, tetracycline, and oxygen are not prescribed in pregnancy. Therefore, you have no choice to give except azithromycin macrolides. So, in pregnancy is concerned, you should choose only azithromycin. Otherwise, there are complications of pregnancy, and specifically is abortion, miscarriage, and ectopic pregnancies. And in infection is progress, and it will cause the pelvic inflammatory disease develops. It can cause infertility. If the infertility is not there, then causing the ectopic pregnancies. The infected mothers can transmit the infection to the child as trachoma. Even pneumonia can occur in the newborns, and you will have to treat with the oral erythromycin base ethyl succinate 50 mg per kilogram body weight per day, divided into 4 doses for 2 weeks, while monitoring of the symptoms of the infantile hypertrophic pyloric infantilitis, an infant less than 6 weeks old. They are associated with this disease. So you have to be very careful. There have been a few reported of the Chalymydias trachomatis strain that were resistant to the multiple antibiotics. However, in 2018, major cause of concern as antibiotic resistance is rare. If this is the problem, then new antibiotics can be tried. Prevention is better than cure. So you have to, the hygienic point of view, the safety of the sexual partners, they are important in this group. The vaccine which was tried by the Institute at the Hammersmith Hospital in London between the ages of women which is between 19 to 45 years, the trial aimed to assess the safety and ability to provoke immune response. 35 women not affected with the Chalymydia were included in the trial. The trial included 2 adjuvants and a saline control group. The vaccine was found to be safe, and all women who received the vaccine, regardless of the adjuvants, developed an immune response against the Chalymydia. So vaccine is available since 2016. It is not available in Pakistan. But the Serum Institute has announced that it will continue to pursue finding to move the vaccine into the phase 2 trial and then third. Because under trial basis, they have done it. It is not used on the humans, and I hope so. In around about 2024, 2025, they will complete this study, and the vaccine can be available. Although it is difficult, a lot of elementary bodies are formed, and a lot of reticular bodies are formed, and mutation can occur in this fashion, and the vaccine is difficult for the practical point of view. Now this is the discussion which I have done, although it's quite boring one, dry one, but you have to understand this Chalymydia trachomatis. وما إلينا إلا البلاغ. السلام عليكم ورحمة الله وبركاته.